Dispute in Nigeria's health sector is not restricted to the federal level alone. It will be recalled that doctors working for the Lagos state government are aggrieved over the non-payment of some months of their salaries over their involvement in a nationwide strike called last year by the Nigerian Medical Association from July 1st to late August. The Medical Guild Lagos issued a 21-day ultimatum from December last year, and these expired on the 18th of January. A withdrawal of service is supposed to follow, but the doctors have decided to give more time.
We did give the administration in Lagos State a 3-week ultimatum commencing from the 29th of December over a number of issues that we had had with the administration. We had complained about the employment of doctors as casual workers with no career path, and these were young doctors. We had complained about the truncation of the residency program in the Lagos State University Teaching Hospital, and residents have not been employed for a while. The hospital is in dire need of residents. We had complained about the incessant and unfair disciplinary boards that doctors had been facing, which we believed was a fallout of the strike of 2012. And we had complained about the selective application of the no work, no pay policy to doctors alone. As you're aware, that policy was first applied to doctors in 2012. Then it was applied retrospectively after the circular was written after we went on strike. And there were at least 6 associations went on strike after that, and for much longer periods than we did. That policy appeared buried and suddenly reappeared when we joined the national strike, which lasted from July to August. And during the week, the government called us, some very top level functionaries of the Ministry of Health and some other people called us and appealed to us not to embark on strike at this time, and said that they were willing to revisit the issues. And we also, as you may also be aware, there are some of the only doctors are carrying out any services in the Lagos State hospitals for now. So on the 18th, the day the ultimatum was to expire, we convened a meeting of the Medical Guild, and that meeting directed that ultimatum be extended by 4 weeks from the 19th to give the government more time to look at the issues with the hope that there will be an acceptable solution in that time.
It's no longer news that in Nigeria, bird flu cases have been recorded in poultry farms in some states like Kano, Lagos and Plateau. But what should interest you is how you can protect yourself and family from the virus. The bird flu viruses do not usually infect humans, but nearly 600 cases of human H5N1 have been reported worldwide since 2003. Let's hear from the Lagos State Commissioner for Health, Dr. Jide Idris, on the containment efforts and how you can stay safe from the virus.
As a state government, our responsibility is to prepare in a manner that will protect our people. And that is why we are collaborating together with the Ministry of Agriculture. And the best way to address this, like he did say, is to prevent the spread within poultry farms or within from animal to animal. It's basically a disease of animals. But occasionally you have a spread to human beings. And circumstances that can allow that to happen has to do with which is rare case, when human beings get in contact with either a dead or dead infected animal, or in contact with fairly uncooked animal that is infected with this kind of disease. And the most important time a human being can't be susceptible to that is when they are preparing these poultry animals, either remove the feathers or trying to kill and slaughter before cooking. when they get in touch with this the virus. It's a viral infection, and the best way to prevent this, which is our responsibility to let people know, just like we always say, that is simple personal hygiene, frequent hand washing, and if you are going to have the poultry, ensure that you do not, if you have any dead poultry near your this thing, just either call a video of agreement to get rid of that. I don't take any chances. It's very unusual for human beings. It's not impossible for human beings to be infected, but again, it's highly, if you take proper precautions. So our own focus in the Ministry of Health is to ensure that this does not spread to our people.
And do not forget to cook your chicken properly. Now let's serve you more of what's in the news. There's global concern over funding for malaria control, but added to this is the findings by scientists on drug-resistant malaria. The genetics underpinning resistance to a frontline malaria drug, artemisinin, have been revealed by scientists from Mahidol Oxford Tropical Research Unit in Thailand. After analyzing 1,612 samples from 15 locations in Asia and Africa, scientists confirmed that mutations of a gene called CALCH13 are strongly associated with malaria resistance. The researchers also found 4 other mutations that appear to work in concert with the CALCH13 mutation. In Southeast Asia, malaria parasites have developed tolerance to the treatment, and there are fears that this will spread. Curiously, each time resistance has emerged, it has started in the same place, on the Cambodia-Thai border, before spreading across Asia and into Africa. This appears to be happening again with artemisinin, a drug that has transformed malaria treatment. Cases have been confirmed in Thailand, Cambodia, Vietnam, and Myanmar, also known as Burma. The researchers said that they did not yet fully understand the mechanism behind this or exactly why these mutations are linked to one area of Asia. But tracking down parasites that have these genetic changes could help them identify the areas where resistance may spread. And in Africa, Mali's health minister says the country is now free of the Ebola virus after 42 days without a new case of the disease. The last Ebola-infected patient in Mali recovered and left hospital in early December. Latest figures show the 3 West African countries worst affected have all seen a decline in new Ebola cases. Mali recorded its first case of Ebola in October when a 2-year-old from Guinea fell ill and died. At its worst, there were 300 contact cases under investigation in the country. The incubation period for Ebola is 21 days, and the country must be free of new cases for 2 consecutive incubation periods to be declared free of the virus. To immunization matters, the price of life-saving vaccines has skyrocketed, leaving some countries struggling to fully immunize children, and that's according to Medicine Sans Frontiers. A report by the charity says there has been a 68-fold increase in prices between 2001 and 2014. The medical charity's report says prices are now prohibitively high, and we're calling into question the sustainability of immunization programs. The document, The Right Shot, says the number of vaccines offered has doubled since 2001, but the price has increased even more so. In 2001, it cost $0.67 to vaccinate against tuberculosis, measles, diphtheria, tetanus, whooping cough, and polio. But the cost has leapt to $45.59 per child. The price to fully vaccinate a child, according to MSF, is 68 times more expensive than it was just over a decade ago, mainly because a handful of big pharmaceutical companies are said to be overcharging donors and developing countries for vaccines that already earn them billions of dollars in wealthy countries. The poorest countries have their immunization programs supported by the Gavi Vaccine Alliance. Finally, US scientists are asking the public to join them in their quest to mine the Earth's soil for compounds that could be turned into vital new drugs. Spurred on by the recent discovery of a potential new antibiotic in soil, the Rockefeller University team want to check dirt from every country in the world. They've already begun analyzing samples from beaches, forests and deserts across 5 continents. But they need help getting samples. They want to hear from people from all countries and are particularly keen to receive samples from unique unexplored environments such as caves, islands and hot springs. Such places, they say, could house the compounds produced by soil bacteria that are entirely new to science. Many of the drugs used today came out of dirt, the antibiotics penicillin and vancomycin, to name just 2. As we wrap up the program, here's nutrition tips for you. What do you think about carrots? The inviting orange color of carrot. This root vegetable can be as small as 2 inches or as long as 3 feet, ranging in diameter from 1/2 of an inch to over 2 inches. Carrots are perhaps best known for their rich supply of the antioxidant nutrient that was actually named for them, beta-carotene. However, carrots are the source of not only beta-carotene, but also of a wide variety of other health-supporting nutrients. The areas of antioxidant benefits, such as cardiovascular and anti-cancer benefits, are the best researched areas of health with respect to dietary intake of carrots. Vitamin A, which is known to boost good eyes, can also be found in carrot. So add carrots to your menu by simply blending them into fruit juice, or eat it and experience its crunchy texture. Thank you for your time on Health News. See you again. I'm Yomi Otaigbe.